Good afternoon. My name is Ardis, and today we're going to be talking about self-management of blood sugar levels. So I'm from the South, and we're notorious at dropping letters. So I always like to always think of, how's your sugar? What's your sugar today? So I have a very detailed description of my audience overall. So you can be either a newly diagnosed or returning diabetic patient, maybe even a caregiver of a diabetic patient. Overall, everybody's an adult, 18 years of age, at least a high school education, may have a history of low sugar, no hearing or visual impairments. But you all are familiar with your glucose meters and you do know how to use them. And then maybe some of the patients are actually on a beta blocker, which I'll even explain that during the presentation. So by the end of the presentation, you should be able to identify the signs, symptoms of feeling like you have low sugar, or another word to describe it is hypoglycemia. So you should be able to know when to check your sugar, distinguish what the number on your glucometer or glucose meter is telling you, and discuss the options of how to manage that, and then identify what to do after treatment. So let me ask you all, what are situations that actually causes your blood sugar to drop?
I skip a meal.
Exercise.
I'm sick.
Sorry?
If I'm sick.
Yeah. Good. Oh, excellent. So I didn't have being sick, but that's an excellent one to remember. But maybe risk factors overall, it's like if you're using insulin, maybe you just are someone who generally has like a frequent low blood glucose and you frequently just have a history of episodes. A lot of people who are tightly controlled may have are at risk of low blood sugar more than someone who's not tightly controlled. You mentioned poor eating habits, exercise, and even alcohol alone can cause your blood sugars to drop. So let me ask you, how do you all feel when your sugar is low? How do you know?
I get dizzy.
Okay.
My heart starts pounding.
Okay.
I'd say I go sweaty, but I'm not even doing anything. I get hungry.
My sugar's always high.
Sugars are always high. Hey, that's okay, but you should know if forever the situation happens that your sugar actually does drop, because you say your sugar's high, but is that based on a number even?
I check, yeah.
Yeah, when you check, but okay. We'll talk about that number in a little bit too later on. So like you all said, a lot of like the shakiness, the sweating, the chills, maybe a rapid heartbeat, lightheadedness, dizzy, hungry. Some people may have blurred vision. And if it gets really serious, people can lose consciousness too, which is why we're having this talk too today. You said, your heart rate beats fast, and not everybody actually may have that symptom. So everybody's symptoms are different. And so someone whose heart beat fast, one person may not beat fast, maybe due to a medication. So, people may be on what's called a beta blocker. If they, so some of those names, I'm going to throw a couple names out so that you're just aware of it, like Coreg or carvedilol, bisoprolol, things that kind of end in all is a drug that you may be taking, but you're probably not going to have that side effect because it's counteracting that side effect. So the question now is, what's our game plan? How are we going to handle this? And there's two, there's few little phrases people like to use. So check, treat, check, or another one I'll explain more in detail later, but I call it the 15-minute rule. So the check portion, we're gonna check, when we're feeling like our sugar is low, the best thing to do is to check your blood sugar. And you all are very familiar with your glucometer. Typically, you know, we characterize it as a blood sugar reading less than 70. But that may not be the same for everybody. Everybody's a little different. Maybe somebody's at 90 and they're feeling dizzy, sweaty, and the symptoms, and other symptoms of low sugar. You know, it's okay to characterize yourself that your sugar is getting low, because your number doesn't always necessarily match the symptoms. But then there's somebody who could be 60 and feel great, and their sugar may be technically fine for that person, but still something to monitor. So does that give everybody a little picture that not everybody is the same? Anybody feel like they're fine if they've checked their sugar and it's below 70? Okay, one person.
Yeah, I normally feel it around like 60.
Okay, that's good that you know that, though. Anybody above 70 and they feel horrible and they feel like they have to always feel like their sugar needs to be almost above 100 all the time. Okay, so you're seeing that people are identifying that a number is not always the answer. Just remember how you feel. So when you feel this way, the next option is to treat. So the recommendation is to, after checking your blood sugar, is to treat by eating or drinking 15 to 20 grams of simple carbohydrates or sugars. So a lot of examples here, you know, a glass of milk, about maybe 2 tablespoons of raisins, you know, 3 or 4 pieces of candy, which all vary based on what the nutritional content obviously is. So I encourage you all to look at the nutritional content of some things and be familiar what you can have that will be good to treat when your sugar is getting low. 4 ounces of juice or regular soda, not diet. Some people may have glucose tablets, so I'm going to hand out some kind of like little emergency kits just for everyone. So we have like a pack of raisins, some jelly beans are good options. Now, understand that these are not to be, everything is not to be eaten. This is just like, this is an option for treat once. And I'll give you a few words. Okay. I'm also going to pass around, you know, some people may have glucose tablets. Feel free to pull one out, put it in your bag, but typically 3 of those will give you about the content of carbohydrates that you would need to raise your sugars to appropriate levels. So then it's important to so this is where that 15, so you treat it with about 15 grams, so wait 15 minutes to check your sugar again. Now the question is, well, what if my sugar is still low? What if I still feel bad? That's okay, repeat treating again. And so you would treat with another appropriate amount of either candy or jelly beans, something with easy sugar that can be broken down. And then you would again wait 15 minutes and check again. So overall, like once your blood sugar has returned to normal, so at least above 70 and you're feeling better, you can then follow up with a small snack that's at least, if your next meal is probably at least an hour or two away. So kind of just wrapping up now. So can some people tell you, we've gone over some signs and symptoms, which you all were very familiar. Can someone describe the check portion for me?
actually have low blood sugar, then you should check your blood sugar to see what your number is.
And at least for now, while maybe if you're new, 70 is usually the range of 70 or less is considered low blood sugar. How would you treat it? Would you eat the entire package?
I'd like to.
Maybe start with the jelly beans, or start with a pack of raisins, and then go from there. And then what's the next step?
Wait 15 minutes.
Yes. And then we're gonna check again. And then of course, follow up with maybe a small meal